All right, everybody. So today we're going to be talking about dizziness and, what dizziness really is, the different kinds of dizziness, and what can be done to actually help these conditions because not many people know that there are actual solutions for these kinds of things. So a little bit about me, for those who don't know, my name is Dr. Dan Perman. I'm a clinician here at Root Cause Medical Clinic. I also run a virtual practice called Virtual Brain Rehab, where I bring these types of services to people who who don't have it accessible to them. It's always good to see a practitioner in person if you can, but some people are not close enough or they can't travel to see one, so I like to be available for those people to try to give them some solutions as best as I can as well. Also enjoy making videos for people to get the help that they need that way too. I'm a board certified chiropractic neurologist. That means I specialize in neurological diagnosis but also rehabilitation, so all non-invasive approaches to fix neurological conditions. Before I came to Root Cause, I ran a practice down in Beverly Hills, California. Recently just moved back up here to settle down a little bit, so really happy to be joining such an awesome team here at Root Cause. A little bit more about me going way back. In college, I did consider a PhD in neurobiology, so while I was in school, I did work as a research assistant at Harvard Medical School, but I found out very quickly that I didn't want to be locked in the lab. I liked seeing people in person and working through things with them together, so I decided to shift a little bit, and that's how I got into the field of neurological rehab. I specialize primarily in migraines, concussions, and dizziness, and today we are going to be tackling the dizziness portion of that. Okay, so first, dizziness is one of those things that it's hard to understand how debilitating it can be unless you actually go through it. Unfortunately, a lot of people end up going through it in their life, and about 40% of adults over the age of 40 are going to experience some kind of dizziness in their life, and about 10% of kids are going to experience some kind of dizziness. That's around up to 90 million people in America each year that will suffer from these kinds of things. It might be more than that, to be honest, because these symptoms tend to be a little bit underreported sometimes. But affecting a lot of people, and a lot of people are just kind of left shrugging. They go to see doctors and other types of practitioners, and they're just told, that I don't see anything wrong with you. There's nothing that I can find. It's all in your head, or, you just have to live with this, and that breaks my heart as a practitioner. So I'm just on fire about getting the word out there about what can be done to help these conditions. There is no, magic cure for dizziness. It's actually pretty complex, and there's a lot that we don't know about these things. But the more and more we dig into what causes dizziness, the more we're trying to figure out solutions that can really help with this kind of stuff. Okay, so for today, I really want us to understand, one, what is dizziness? How do we find the root cause of that dizziness? And then what can we do non-invasively to treat it? Because the traditional medical treatment for dizziness is really not that great. There's about one medication that helps with motion sickness, and that's only one kind of dizziness. You're going to learn that there really is much more to dizziness than just, feeling queasy or something like that. Okay, so when it comes to dizziness, there are a number of potential causes. Sometimes a fever can cause dizziness, or low blood pressure can cause dizziness. But there is a general concept that outlines most of what dizziness is. And it all comes down to an issue with your brain's body awareness. Because one of your brain's most important jobs is to understand where your body is in space. And because this is so important, there are multiple systems in our body that are feeding the brain information to give us that awareness, kind of like checks and balances. It really wants to be confident as to where we are. Now, there are three main systems that give us that awareness. The most obvious are the eyes. They give us a physical picture of the world around us. But then there are little tubes inside our ears that are filled with fluid called the vestibular system. And the vestibular system gives us information about head movement, so when you're moving your head around. Then there are sensors in all of your muscles and joints called proprioceptors, and proprioceptors give the brain information about where the muscle and the joint is in space. And in order for the brain to understand fully where we are in space, all three of those systems need to tell the brain the same exact thing. As long as they're all saying the same message, the brain's able to process that information and it all checks out, then we're good to go. Brain knows where we are, and then everything is fine. But if for some instance one of those systems starts saying something different than the other systems, now there's a mismatch. One system says one thing, the others say another thing. The brain is getting differing information from each of these systems. It can't quite put everything together, so how does this manifest? As dizziness. Now, dizziness itself is kind of an umbrella term. When somebody comes to me and they tell me that they're dizzy, that doesn't really mean much to me because there are many different types of dizziness. And the kind of dizziness that you're experiencing really does help me diagnose this. It helps me figure out where is this all coming from, and then from there, what is the best way to treat it. So you'll see here on the screen feelings of spinning, waving sensation, motion sickness, lightheadedness, unsteadiness, blurry vision, clumsiness, nausea. All of these symptoms fall under the umbrella of dizziness, but in reality are very different symptoms and are treated completely different ways. There are some types of dizziness that cause spinning sensations that we can fix within a couple minutes. It's called positional vertigo, whereas sometimes the waving sensations or the lightheadedness can often take months and months of rehabilitation to make a ton of change. But it's very important as we go through your care that we start by fully understanding the kind of symptoms that you're experiencing so that I can, target in and figure out where is this coming from and what might I need to do to build the most effective treatment plan for you. Now, as far as identifying the problem and how we do that, honestly, it starts with a history. It starts with a very in-depth history. And I like to spend a lot of time talking to my patients when I first meet them about what it is exactly that they're experiencing. What kind of dizziness? When did it start? Was there something that brought it on? Because that oftentimes can get me about 80 to 90% to the diagnosis, just understanding all of the things that you've been through up to the point when you come into my office. But then we need to confirm that and figure out what might be good for you to work on. So that's when we go into the neurological exam. And with the neurological exam, we're testing all those systems that we talked about previously. We're testing the eyes. We look at eye movement and visual acuity. We'll test the inner ear, do some vestibular testing, look at head movements and how things change when you're changing position, for instance. And then musculoskeletal, the proprioception, the muscles in the joints. I might palpate your spine, see how you're moving, check your coordination, balance, things like that to give me an idea of how the proprioception or the muscle and joint information is talking to you. Sometimes there's some additional stuff we might want to do, tilt table testing. That's, I might lie you down, lie you up, see how your blood pressure changes, see how your symptoms come on with those changes in position. That's for more like lightheadedness conditions. And then, it's important that we have a strong internal environment as well when we're talking about dizziness. So that's why the nutritional evaluation and the hormonal evaluation is oftentimes appropriate for these kinds of cases. In that instance, we have you work with the functional medicine team to uncover anything that's going on there that needs to be worked on a little bit deeper. Now, how do we go about treating these kinds of things? Honestly, we need to recalibrate the system. We talk about how the eyes, the inner ears, and the muscles and joints need to be speaking the same language. So we try to identify, which one of those systems is not doing its job correctly, which part of the brain is having trouble processing that information or putting it together. And then from there, what kind of exercises and therapies can we design for you to retrain all those systems so that they're speaking the same language, strengthen the system that's as weak as possible, strengthen the part of the brain that's weaker so that the brain can maintain a better understanding of where you are in space. And with that, we see that the dizziness symptoms tend to reduce quite a bit. So if we think that it's a big problem with your eye movements, we might do a lot of gaze stabilization exercises or eye motion exercises. If we think that it's more of a vestibular issue, we might do head-eye vestibular motion therapy or other kinds of vestibular rehab like rotation therapy, something like that. If we're concerned about the proprioception or the muscles and joints, we might have you do some coordination exercises, some balance exercises, some head and neck movement exercises to try to improve the quality of the information that's coming in from those muscles and joints into the brain. Oftentimes, musculoskeletal therapies are very beneficial here as well. Things like vibratory therapy, spinal adjusting, exercise therapy, muscle work, physical therapy techniques, things like that can be really, really beneficial to make sure that those muscles and joints are speaking the right language. And then, if necessary, we will dig into the nutrition and the hormone side of this. It is related in certain cases for dizziness, not always, but it's one of those things that you just don't want to miss. So it's usually worth at least having a consult with somebody who knows what they're talking about on the nutrition and hormonal side, so we can see if that's an underlying issue. Because if we don't address the nutrition and the hormones, we might not get as much benefit out of the rehab as possible if your brain doesn't have the right building blocks. So it's important that we also take a look at that as well. Now, I want to go a little bit into the objective measures that we take, because we want to make sure that you're not just feeling better. We want to see it on paper. We want to make sure that we're helping our patients in big ways. So it starts with an outcomes assessment, a questionnaire called the Dizziness Handicap Inventory, or the DHI for short. And it's a short questionnaire that gives us a picture of how your dizziness is affecting you, basically. We have you fill this out right at the beginning of care, and then as you progress through care and we're reassessing you, we might have you fill it out again to see what's changed. You know, we want to know that we're pushing you in the right direction with this kind of thing, and outcomes assessments help us do that. Now, as far as looking at all these systems that we talked about, the muscles and joints, the eyes and the inner ear, or the vestibular system, I like to get a little bit of objective data with that as well, not only to track your progress, but also just so I can better understand which systems might be doing their job better or worse. One of the tools that I use beside my general, bedside exam is a balance plate called a B-Trax assessment. And the B-Trax assessment gives us a picture of your overall balance, and it gives us a fall risk score, or how steady and stable you are generally. But it also allows us to do another test called a CTSIB test, where I can pull apart all those systems that we talked about. So we can do a test looking only at the muscles and the joints, do a test only looking at the eyes, and do a test only looking at the inner ear, the vestibular system, to see how those are individually contributing to your balance. And that can oftentimes help guide me as to which systems we need to work on a little bit deeper. Just so you understand about how we read these assessments, you'll see right here the baseline, and that's the first test. Then there's a post-baseline. That's when we test them again after we've done some work with them. Now, on this test, the lower the score, the better. We want a low score because this balance plate is testing how much you're moving around. So if you're moving around more, you're going to have a higher score. Now, this case, this person started at a 60, which is higher than we like to see. That was about the 2 percentile for this person's age group. And then after some rehabilitation, we were able to take them down to that 22, which is about normal for somebody their age, like the 70th percentile or so. That's a 63% change. That's huge for this person, and they felt a lot better after we did some work with them. Now, this test, this is one of the toughest cases for me, because this was a young woman in her 20s who was a long-standing patient of us for migraines and had done really great. We hadn't seen her in months. Well, she ended up getting a head injury. She hit her head on a table while she was at school and was left with just crippling dizziness. She went through about 2 months trying to just figure this out on her own before she had to actually leave school and move home, which brought her back into my office. Now, you'll see a baseline score of 162. That is very, very high. One of the worst scores I've seen on this. We worked on her for about 2 weeks, and that's when we ran this other test with a post-baseline of 37, a 77% improvement. Now look, she's not all the way there at this point. She's still at a moderate fall risk, and she's now in the 4th percentile rather than the 0 percentile, but she was feeling much, much, much better at this point. And I don't have the test here, but we ran this a few weeks later, and she was relatively normal. She was above the 50% percentile at that point. So a good success story there. Happy to see that she was doing a lot better. But it's important to know that you don't have to be experiencing symptoms to benefit from this kind of stuff. This test is an athlete who just wanted to optimize their performance as much as possible. So you see, they started with a baseline score of 30, which isn't terrible, but it's not great, it's slightly below average. We only worked with this gentleman for, I think, 2 or 3 weeks, teaching them therapies to work on to improve their balance, coordination, and overall spatial awareness. And you see, even with somebody that really isn't experiencing any symptoms, we were able to take that score down about 27% and improve their overall function. So we do work with just overall optimization. I've worked with, Olympian athletes, with ultimate fighters, people who just really need to be very visually acute, very responsive to their environment. They do really, really well with these kinds of things as well. Okay, very briefly, just some of the neurological exercises, because that's one of the biggest questions I get is, okay, well, what kind of exercises do you do? It's a lot of retraining eye movements and head movements. We need the brain to understand where your body is. So one of the easiest ways we can do that is by moving the eyes and the head. Because when we move the head, we're working on the muscles and joints. We're also working on that inner ear. When we have you use your eyes, either focusing on a target while you move your head, or moving your eyes around while you move your head, or even keep your head still, we're able to work on all those systems in an easy, safe way. So, I will oftentimes help improve people's balance without ever even practicing balance. Oftentimes, just by having them sit and focus and recalibrate these systems that give their brains awareness, that is oftentimes enough to improve your balance. Oftentimes, people that have imbalance, it's not a balance problem, it's a spatial awareness problem. We need the brain to understand where they are a little bit better, and with that comes the better balance. So you'll see, all of the pictures to the left side of your screen. Those are all different ways that we can retrain your eye movements and your head movements. Now on the right side of your screen, you'll see various electrical stimulators. These are things that we can use as well to help with this kind of stuff. The one up top is a peripheral nerve stimulator. So typically we stimulate nerves in the face to strengthen the brain as much as we can. When we stimulate the face, it stimulates the parts of the brain that deal with balance and coordination and overall awareness. So we just give that a little bit of a help. We can also, with that therapy, do stimulation to the legs. If you do have neuropathy per se that is keeping you from having great balance, we can stimulate the nerves in the legs to try to get those stronger as well. The device down below there is what's called a high volt galvanic stimulator, which is we usually use that for vagus nerve stimulation. And vagal stim is much more relevant for concussion rehab and for migraine rehab, but because dizziness is such a common symptom of those other conditions, and because the areas of the brain that are affected in dizziness are right around that vagus nerve, oftentimes I will do some direct vagus nerve stimulation to try to give those systems a little bit of a boost as well. That's a basic introduction to dizziness. It doesn't have to be a super complicated thing. It does when you get down into the specifics, but the general concepts are, we just need your brain to understand where it is better. And when the brain understands where you are, those symptoms of dizziness oftentimes improve a lot, a lot. If you have questions about this, please reach out to the office, get on the phone with me. I'm happy to chat with anybody about what they have going on, see if I think I might be able to help. I'm very straightforward about this kind of stuff. If you have a loved one that's dealing with this, please also send them my way so that we can get to the bottom of this, because these conditions really, really, really can take it out of you. And it can feel very lonely when you're dealing with dizziness, because people don't get what it feels like to be dizziness. They don't realize how debilitating it can be, and oftentimes they're just passed from doctor to doctor to doctor without any real solution. I want those people to know that there is hope. A lot of these people can get better with these kinds of symptoms. It just takes the right approach and the right amount of time to rehabilitate these things as effectively as possible. Again, my name is Dr. Dan Perman. It's been a pleasure to talk with everybody today, and I look forward to meeting all of you soon.